Good day everyone! I am Monica de Guzman, a student nurse from Davao Doctors College. And so for today's video, I will be demonstrating how to properly get the vital signs of the patients. So before anything else, let me show you the materials needed for this assessment. Hi sir, I am Monica de Guzman, a student nurse. And for verification sir, can I ask what is your name?
Romeo Amper,
Okay, how old are you sir?
19,
Okay, birthday sir?
December 29, 2002.
Okay. Before anything else, sir, what do you want me to call you?
Sir is fine.
Okay. May I know, sir, why are you here in the hospital?
For my health checkup.
Okay, sir. So for today, I will be getting your vital signs. It is important to know if there's any problem in your health conditions or there is none. So vital signs has four types, which is the temperature, the pulse rate, the respiratory rate, and the blood pressure. So we are considering the pain as the fifth vital sign. So may I ask, sir, if you have any pain right now?
None. I don't feel any pain right now.
Okay, that's great, sir.
Excuse me, nurse. What do we do first?
Our first step for our assessment, I'm getting your temperature. So I already closed the windows and the doors so that you will be more comfortable throughout our assessment. Wait a minute, sir. When using the thermometer, wipes the thermometer using the alcohol swab in a firm twisting motion prior to its placement. It is to avoid getting any microorganisms. Place the thermometer and wait for the appropriate amount of time. After using it, wipes the thermometer using the alcohol swab in a firm twisting motion prior to its placement so that you can proceed to the auxiliary method. After performing the oral temperature, you have to sterilize or to and sanitize the thermometer so that you can proceed to your auxiliary method. Place the thermometer and wait for the appropriate amount of time. Wait for seconds and try to relax. After using the thermometer, wipes the thermometer with an alcohol swab in a firm twisting motion prior to the placement. It is to avoid the spread of any microorganisms. So the next thing we do, sir, is I'll be getting your pulse rate. The first step, we have to select the pulse point and position the client accordingly. The reason why we position the client accordingly, it is to make them comfortable throughout the assessment. Next, we have to palpate the peripheral pulse by placing the first two fingers on the pulse point with moderate pressure. Next is, we have to palpate and count the pulse for 1 full minute. And of course, aside from those, assess the pulse rhythm and volume to have an appropriate result. Lastly, you have to document the pulse rate and the volume and the client's record to have a proper documentation. When you're done getting the pulse rate, it is appropriate to get the respiratory rate continuously. Observe and count the respiratory rate to have a proper result. Count the number of inspiration, intake of air into the lungs, because it represents as the respiratory rate of the patient. You also need to observe the depth, rhythm, and character of respiration. Then after that, lastly, you have to document the findings so that you have a proper documentation. The next one, sir, I'll be checking your blood pressure. Wrap the deflated cuff around the arm so that you will get the proper result of the blood pressure of the patient. If this is the client's initial examination, perform a preliminary palpatory determination of systolic pressure. You have to position the stethoscope appropriately so that you will easily hear the sound of the pulse. You should also keep your eyes on the gauge so that you will get the appropriate result. Slowly release in the pressure in the cuff by opening the airflow so that you will determine the blood pressure of the patient. Okay, sir, we are done with your blood pressure. And lastly, you have to document the result. Okay, sir, I am now done taking your vital signs. So for your oral temperature, you have 37 degrees Celsius. And for your axillary temperature, you have 36.5 degrees Celsius, which is normal. So for your pulse rate, you have 37 beats per minute, and that's normal. So for your respiratory rate, you have 16, and that's also normal. So your blood pressure, you have 120 over 70, which is also normal, sir. So that's it for today, sir, and thank you for so much for your cooperation.
Thank you also.
Yeah.